Epidural epidemic. Many women trust that their doctors know what's best for them and would never allow them to undergo a questionable medical procedure without first informing them of the risks. As a result, most women in the U.S. today routinely forego natural childbirthing methods and choose to use pain-relieving aids such as anesthetic epidurals. Buckley and Wagner. There are no doubt many women who, having labored many hours or days in pain without rest, welcome the relief of an epidural. What most women don't know is that in addition to not providing adequate pain relief in 10 to 15% of women who use them, epidurals have never been proven medically safe. Wagner. Anesthetic epidurals actually pose higher risks, complications, and general interference to almost every aspect of this normal natural life process. Therefore, the benefits are outweighed by the risks in normal low-risk childbirth. Epidurals are often adverse to the mother's health and ability to maintain control of her birthing experience. The result of numbing removes her from being an active participant in the birthing process, taking away all her personal power to control the situation and her independent ability to move throughout labor, including switching positions, going to the bathroom, and being able to work with gravity and her body to speed labor and delivery. The forced bed laboring position actually closes the pelvic opening up to 30%, and many women may cause women to be in a position that is injuring to her body without even knowing it because of the numbness. Benek Gastaldo. There are many more complications of labor when a woman has an epidural, and side effects are not just possible but rampant. One example, she has to be catheterized due to urine retention. The risk of contamination, infection, and irritation rise every time a foreign object is introduced into the body. Similarly, 25 to 34% will experience postpartum bladder dysfunction, i.e., losing control of bladder function, sometimes for months afterwards. James. The most common side effect is hypotension, occurring in over a third of mothers who choose epidurals. To combat hypotension, women are pre-treated with IV fluids, including saline and hormones, but blood pressure supply and oxygenation issues causing maternal respiratory distress still often result. Buckley. Other common side effects include uncontrollable shivering, itching, nausea, vomiting, emotional separation, short-term back pain, spinal headaches from leaking cerebrospinal fluid that can last days to weeks, and an over-doubled likelihood of long-term back pain. James. Epidurals are detrimental to the labor process. Epidurals interfere with the natural arc of all labor hormones. Oxytocin, the love hormone, and a uterotonic that causes contractions, is crucial to all parts of starting and progressing labor. The highest levels of oxytocin in a woman's life are released at the moment of birth. There are also beta-endorphins, which help transcend pain and is associated with altered states of consciousness. In natural labor, shortly before delivery, there is an adrenaline-noradrenaline release that gives the mother the rush of energy to allow her to push, even after an exhausting labor. All of these hormones are severely inhibited, both in quantity released and effectiveness in the body, when an anesthetic epidural block is present. Berkeley. Combine this with the mother's inability to physically do anything that can move the process along, it is not surprising that many studies have shown that epidurals actually slow down labor and make it take much longer than most natural births. This means there is an increased need and usage of other drugs and artificial hormones to get things going again. Because of the many adverse reactions that either the mother or fetus may have to the medications and the epidural, it becomes necessary to continuously monitor and check the progress